I'm Mark Lorenzato, founder of MD TEAM. We're talking about repurposed medications, so you can be familiar with what we do. There are quite a few we use. I'm listing about 10 in this video. First one, doxycycline. Doxycycline is just one of several antibiotics that can have a profound effect on the outcome of an individual with cancer. Doxycycline is known in certain cancers to potentiate the cancer apoptotic pathway, to promote cell death, to help cancer cells decide to die where other cells don't. So many people, if you have prostate cancer, breast cancer, different carcinomas, many other cancers, should be on doxycycline for an extended period, perhaps 6 weeks, enough between CAT scans or MRIs to understand if you're having a good kill rate from it. It's one of the things you can do. There are other antimicrobials, the medicines that are used to knock down malaria, knock out malaria, they can be very effective. Hydroxychloroquine, very outstanding drug used in the right situations in cancers, and maybe you should be using it. Dexamethasone and other steroids in certain cancers, they have a very powerful effect at killing cancer cells, something to entertain in specific cancers. Diclofenac, an anti-inflammatory. Let's say you need an anti-inflammatory from arthritis or just pain occasionally. Which one should you choose? One that kills cancer cells. It only makes sense. Which cancer cells are killed by it? Well, I can't say offhand, but in your cancer, I might research it and say that's the one you need. How about a beta blocker? If you have a heart condition or hypertension and need to manage it, should you be on propranolol or carvedilol instead of another one? Probably. They are both shown to be very beneficial under certain circumstances in killing cancer cells. We can go on. The idea, you have it, is that medications can both be repurposed from other illnesses and used to kill cancer cells, or they can be part of an integrated strategy, including dietary restrictions and fasting in order to kill cancer cells. At MD TEAM, what we've done is set up kill cycles, understanding some about the apoptotic or natural programmed cell death pathway and its kinetics, how long it takes to develop, to get moving, and before it dissipates. And we realize that a person can be in a ketogenic diet followed by fasting for 1 or 2 days and have an increased cancer kill rate. What we do then is we stress the cells out through increased reactive oxygen species, ROS, tweak some of the redox potential of the cells, create a more difficult cell situation for the cancer cells to recover from. And in light of these things and restrictions of certain nutrients that cancer cells need particularly, you have a chance of a better cancer cell death rate, which definitely is something you want to do because that translates into better survival. So I think you've got an idea. The idea of what we do is not just using chemotherapeutic agents that were designed solely for that, but to repurpose some medications that have direct advantage if you have cancer, and that you should be taking probably if you do any type of chemotherapy or radiation therapy, including most immunotherapies. Very good. Mark Lorenzato, hope to hear from you. Thanks.